Hi everyone, today we'll be talking about discharges on System 1. In System 1, discharging a patient is a two-part process. First, the patient is tagged as being ready to be discharged by the doctor, and then the actual discharge process is done by the nursing staff that gets the patient off of the ward view. So currently we're at ward view now, and I'm in a different hospital in a different ward. And what we're going to do is we're going to look at Belinda Tester here on bed 10. What I want you to notice is that she has a unique icon on her bed, which is a red cross with a green arrow. If you want me to be a little bit more specific, I can circle it here. This is your ready for discharge icon. So this is somebody that has been tagged by the doctor as being ready for discharge. If I wanted to see all the patients that were ready to be discharged, I can look in my general menu bar on the right hand side, and I can look in my ready for discharge category. There I can see how many patients are ready to be discharged, and if I do a single left click, it can actually change my ward view so I only see the patients that are ready to be discharged. To go back to all patients, I just need to select all patients in my general pane. So let's look at how we mark a patient as ready for discharge. This again, as I said before, is done by the doctor. So I'm going to choose Loris Anders on bed 6. I'm going to right click on her name, and I'm going to select discharge from the drop down. When I hover over discharge, I'm going to get a second drop down that has a few options surrounding discharge. Where I'm going to go is to manage discharge status. I'm not going to go to discharge patient. I'm not going there. I'm going to manage discharge status. If you go to discharge patient, the end result of that is the patient leaving the ward view altogether, and then they'd have to be brought back and readmitted, and the entire process has to be done over on the system. So we don't want that. If your intention is just to mark the patient as ready for discharge, we're going to go to manage discharge status. Now here we get a manage discharge status pop-up. In these different sections, we have the expected discharge date, known as the EDD. Most times you won't be filling out this section. And then we have the section called medically ready for discharge, which is where we'll tend to focus on. If there are any discharge delays because the person went past their expected due date, that's indicated here as well. But the main area that we want to focus on today is medically ready for discharge. So what we would do is just take the checkbox that says ready for discharge, and then where we see medically ready on, we can click in that box and pick the date when they're ready. So I'm going to pick today, and then in medically discharged by, we can click in that box again, and we can find a particular doctor that discharged a person. So this can be done on behalf of a consultant that made the decision that a patient can be discharged. So I'm going to pick consultant cardiology, and I'm going to click OK. Now what you've noticed is that at first you don't see anything on Loris Anderson's bed. So what you can do is you can go to the top of your ward view and select the button that says refresh. When we do that, we can now see that Loris Anderson has been tagged as ready to be discharged, as evidenced by this icon here. And when we go to our general pane on the right hand side, we can see that we now have 3 patients ready for discharge instead of just 1 before. This is how we mark patients as ready for discharge. Thanks for watching.